bright spot. This is our Mental Health Matters. Today with us, we have Miss Meredith Carter. She is our Extension 4-H Specialist out of District 11. And also co-hosting with her today is Kaylee Scott. And I'm going to turn the program over to y'all at this point. Those of you that have questions, please mark them in the chat. I will also be putting a link in the chat for you to sign up so we get a check-in sheet, so to speak, and we know exactly who participated in today's session. So at this time, Meredith and Kaylee, I'm going to turn it over to y'all.
Hi, everybody. Kaylee, you want to do a mic check real quick?
Hey, can you hear me?
Perfect. Can everybody hear us? All right. So we wanted to start by thanking y'all for joining us today. Mental health is such a huge topic and it's so very important. And we are glad that it's becoming a topic that we can easily talk about now. And so things like mental health and your overall health and how it plays into your everyday life are some of the things we're going to talk about. And then we're also going to talk about how you can help somebody if you know that they're going through a mental health struggle. And so what I'm going to do is I'm actually going to turn my camera off and tell me if y'all can see the PowerPoint. Jana, can y'all see the PowerPoint? Perfect. And so we're going to just kind of walk through some of the things today. Certainly, as you have your questions, we want to hear from you. Kaylee nor I are mental health professionals. However, we are both certified mental health first aid instructors. And so we've gone through some mental health training and we know how to direct you in the right direction if you have some questions. But today's session is meant to be educational in purpose. And so as we walk through things today, you may think, wow, that's me. Wow, I feel like she might be talking about me or she's talking to me. And that's great. We want that. But we also want you to know that Kaylee nor I are mental health professionals in any way, shape, or form, but we certainly know how to connect to those resources. So, Kaylee, I'm going to let you get us started.
So I actually have a master's degree in counseling, but life kind of took me in a different direction and brought me to 4-H, which I'm very thankful for. But during my time in the counseling program, one of the biggest things that I took away from that mental health training was using inclusive language. So I want to talk a little bit about using person-first language, not just for mental health, but for other maybe physical disabilities as well. And so person-first language is just the idea that when we are speaking about somebody, that we refer to the person first and their diagnosis second, right? So we just really want to be mindful that a person is not defined by their mental health diagnosis or other physical diagnosis that they have. So maybe instead of saying, oh, you know, my handicapped neighbor, you would say my cousin who uses a wheelchair. And so just really putting that person before their diagnosis. I also wanted to talk a little bit about being careful and mindful about overgeneralizing terms. Terms like retarded, OCD, bipolar. A lot of people, even adults that I talk to, I kind of hear them throw those terms out there. You know, they'll make a joke about, oh, I'm OCD about, you know, my desk or, you know, my vehicle. But that's a real legitimate diagnosis. And originally when these diagnoses were created, like mental retardation, that was neutral in meaning when that was created. And then over time, people misuse those terms, which really just stigmatizes people who have those diagnoses or disabilities. And so I just really want you to be careful when you're using terms like that, to be mindful that those are real diagnoses that people live with and often suffer from. So be careful about overgeneralizing.
As we talk about mental health, I think it's really important that we really put the definition out there of what mental health is and what it means. Because I think sometimes we don't often know the full definition, right? And so mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, and can work productively and fruitfully, and is able to make a contribution to his or her community. And so what this means is, as we are kind of walking through our everyday life, it's being able to do things that you would be able to do to function as a person. And so things like your daily hygiene or your normal work or school routine, those kinds of things, hanging out with your friends. We want to make sure that those are all things that we look at when we look for good mental health strategies and coping mechanisms.
Absolutely. So when you think about mental health, it's just like our physical health. And as you can see on the screen, our mental health lies on a continuum, right? So kind of that line that is there, a continuum between healthy and unwell. And so if you think about your physical health, your healthy would be, you know, just like your regular physical health. And then you can kind of go down into maybe the struggling or unwell. And that's maybe where you're getting a cold, or into the unwell area where you're really needing to seek maybe emergency medical services. It's the same thing with our mental health. So when we're in a healthy state for our mental health, we've got good work-life balance, we are physically and socially active, we have good normal sleep patterns, we feel in control mentally. As we kind of slip out of healthy, and we all do this, you know, within our lives, over our lifetime, maybe even day to day, we can come along this continuum. And then we come into coping. And this is maybe where we're functioning, but we're not really excelling in what we're doing. We're decreasing that socializing activity, maybe have some trouble sleeping. We notice that we have lower energy and start to have some maybe feelings of sadness or being overwhelmed. Then we can fall into struggling. And this is when our life and our work is really impacted in a negative way. Maybe we're avoiding our friends and social activities. We're feeling more fatigued. And then those feelings of sadness or hopelessness become really pervasive. And then when we're past struggling, we get to the unwell point. And this is when we really need to seek emergency mental health services. This is maybe where we're isolating, have excessive anxiety or physical exhaustion or illness, and thoughts of suicide. So it's important to note that while most of us never really reach that unwell, most of us do run along that healthy coping, struggling in our day-to-day lives.
So here's some statistics on mental health and facts on mental health in youth. So 50% of all lifetime mental illnesses develop by the age of 14. 75% of them will develop by the age of 24. And so we know that 1 in 6 youth, age 6 to 17, experience some sort of mental health challenge or disorder each year. And currently, suicide is the second leading cause of death among people aged 10 to 34. And so as we look at these statistics, we know that mental health is so very, very important to our youth. And so we really feel that if we can start some of those, what we like to refer to as protective factors, if we can have some positive influences, then we can have positive impact on a person's mental health and hopefully decrease their chances of developing a mental illness as they enter early adulthood. Or late adolescence, early adult.
I see a few of you putting in the chat, sharing some of your own experiences, and I want to thank you for doing that and encourage you to keep doing that, not just in our chat, but in your daily life as well. At the end of the presentation, we'll talk a little bit more about why that's so important. So I just wanted to thank you for doing that. So when we're talking about adolescence and the teen brain, there's a couple of things to note. That the brain continues to mature even after it's done growing. So even though the brain may be done growing in size, it does not finish developing and maturing until the mid to late 20s. So the prefrontal cortex is one of the last regions in the brain to mature. And that is what is responsible for skills like planning and impulse control. So because these skills are still developing into your 20s, teens are less likely to consider the consequences of their decisions. It's also important to know that the teen brain is ready to learn and adapt. So that means that challenging or creative mental activities can help the brain mature and adapt. Just like Meredith talked about, many mental health disorders begin to appear during adolescence. And then most importantly, the teen brain is resilient. So although adolescence is a vulnerable time, most teens do go on to live healthy adult lives.
So we're going to start talking about some common mental health disorders in adolescence, but like Kaylee said, generally speaking, majority of our youth are extremely resilient. And I think that's one of the most awesome things that I see in youth today. They experience challenges like we've never seen before, but majority of them can cope and deal with these challenges as they're thrown our way, and are pretty resilient when it happens. And so what we're going to do is we're going to talk about 4 really common mental health disorders in adolescents and teens, and then kind of walk through each of those and maybe how you can help somebody experiencing those. So in the text chat, I want you to answer these for me. What is the average age of onset for a person for mental illness? When do we start usually seeing signs or symptoms? Can anybody guess? All right, so keep those guesses coming in. But half of all mental illness occurs before a person turns 14 years old, and 3/4 of mental illness begins before the age of 24. And so we talked a little bit about that. Here's some more detailed statistics. Depression occurs approximately in 13% of 12 to 17-year-olds. Anxiety occurs in approximately 32% of 13 to 18-year-olds, excuse me. Eating disorders often occur in almost 3% of 13 to 18-year-olds. And as we talk about ADHD, we're not going to really hit on that too much, but it occurs at approximately 9% of 13 to 18-year-olds. And so when you look at that, those 13 to 18-year-old, that age range is really important. And that's really a very crucial time when we start talking about mental health and how we can incorporate some protective factors into your life. So according to SAMHSA, somebody dies from suicide every 12 minutes. And over the past 2 decades, our suicide rates have increased in every state across the country. So 2 years ago, suicide was listed as the number 3 cause of death. And now it is the number 2 cause of death in adolescence. Zachary, I did say that 9% of 13 to 18-year-olds have or experience some sort of ADHD. So, all right.
So first we want to talk about depression. Like Meredith just said, it is one of the most common diagnoses that a teenager will have as a mental health diagnosis. Basically, depression is a serious mental health problem that causes a persistent feeling of sadness and loss of interest in activities. I think I saw somebody earlier in the chat mention something about numbness of feeling. That could be a symptom as well. Depression really affects how teenagers think, feel, and behave, and it can cause emotional, functional, and physical problems. So of course, teenagers go through a lot of ups and downs in life. That's just really part of being a teenager. And that can look a lot like depression sometimes, but for some teens, those lows of life are more than just temporary feelings. They're a symptom of depression, and that's when it's that persistent feeling of sadness and loss of interest. Some signs and symptoms include a change from previous attitude and behavior, and that can cause significant distress and problems either in school, at home, social activities, or any other areas of life as well. It's really not known exactly what causes depression, but there are a variety of issues that can be involved, like brain chemistry. You know, we've got chemicals in our brain, and if those are abnormal or impaired, that can lead to depression. Of course, hormones, inherited traits. So if somebody has a blood relative who is also diagnosed with depression, their relatives are more likely to be diagnosed with that as well. Early childhood trauma, that can cause changes in the brain that would make a person more susceptible to depression. And then learned patterns of negative thinking. So that can be linked to feeling helpless rather than learning to feel capable of finding solutions for life challenges. So it's really important, especially in those teenage years when we are learning to deal with life's challenges, that we learn patterns of positive thinking and finding solutions rather than negative thinking and feeling helpless. Meredith, are you talking?
Yeah, I was talking to myself. Okay, so I was on a roll. But so anxiety disorders are really the most common health concern in the United States. I hope y'all can hear me now. And so most people develop symptoms actually before the age of 21. And so anxiety is that persistent, excessive fear or worry in situations that really are not threatening. There are emotional symptoms, feelings of apprehension or dread, feeling tense or always anticipating the worst. And then there's also physical symptoms, right? And those physical symptoms can often mimic a common physical health concern when we talk about like heart attacks. And so it's that pounding, racing heart, the sweating, the headaches, the fatigue, insomnia. Sometimes you have an upset stomach. And so what we know is that we all experience some sort of anxiety. Some of you, you may feel anxious when you're speaking in front of a group, but for some, that anxiety motivates us to practice and prepare, right? Driving in heavy traffic is another common source of anxiety, but it helps keeps us alert and cautious to avoid those accidents. But when those feelings of intense fear and distress become overwhelming and prevent us from doing our everyday activities, that's when an anxiety disorder may be the cause. And so we really have to be cognizant of that. And so anxiety disorders are a group of related conditions, but they all have one thing in common. There's this persistent, excessive fear or worry in a situation that's really not threatening. And so there are many types of anxiety disorders, and I'm going to talk just about a few of them right now. There's generalized anxiety disorder, which is exaggerated worry about everyday life. Those are things where you worry about everything going on in your life, and it's the littlest of things that you tend to worry about. Social anxiety disorder causes intense fear about social interaction, and it's often driven by irrational worries about humiliation. So panic disorder is characterized by panic attacks and sudden feelings of terror. It can strike repeatedly and without warning. You often mistake these for a heart attack, but a panic attack causes powerful physical symptoms, including chest pains, heart palpitations, and dizziness. There's phobias. We all have fears of certain things, right? Some of us have fears of spiders, different things. But we all tend to avoid seeing things like that that make us uncomfortable or fearful. But for someone with a phobia, certain events or objects create powerful reactions or strong irrational fear. Many people will work hard, very hard, to avoid their triggers. So people who experience one or more of the following emotional symptoms, people typically experience one or more of the following symptoms. So when we look at our emotional symptoms, we've got to talk about that feeling of apprehension or dread, the restlessness or irritability and being watchful for signs of danger. You're anticipating the worst at all times, or you're feeling tense or jumpy. So, but there are some physical symptoms we've also got to pay attention to, and that's having that pounding or racing heart and shortness of breath, sweating, tremors, twitches, headaches, fatigue, insomnia, upset stomach. All of those are physical symptoms of anxiety.
So eating disorders, they typically affect young people and women, but it can affect people of any age or gender. Symptoms commonly appear in adolescence and in young adulthood. And it's important to recognize that men and boys may be underdiagnosed due to differences in seeking treatment, right? So just typically across the board, women and girls are more likely to seek treatment for a mental illness than men and boys. So often those numbers are unreported. So eating disorders are a group of related conditions that cause serious emotional and physical problems. Their common element is that they all involve extreme food and weight issues. But each of the diagnoses has a unique set of symptoms that separate it from the others. So of course, the two that you hear the most about is anorexia nervosa and bulimia nervosa. Anorexia being the denial of food to the point of self-starvation, and bulimia being the binging of large amounts of food in a short time, and then attempting to rid those excess calories by either vomiting, abusing laxatives, or excessive exercise. However, there are some other types of eating disorders that are less commonly known, but you might see symptoms of these in yourself or your friends, your family members. Orthorexia is an obsession with proper or healthful eating. So somebody who becomes really involved with eating healthfully, and that becomes kind of a main point of their life there. Pica involves eating items that are not typically thought of as food, and they do not contain significant nutritional value. Rumination, that involves the regular regurgitation of food that may be rechewed or reswallowed or spit out. And then laxative abuse and compulsive exercise, those sound just like what their names are. And then there's several other types like other, avoidant, or unspecified eating disorders. So those include characteristics of an eating disorder that causes significant distress or impairment, but it doesn't really meet the criteria for any of the other types of diagnoses. So we often see this in adolescents due to environment. We know that our culture pressures a ideal type of body, not only for women, but for men as well. There's a lot of peer pressure, especially with social media and all of that we have involved in our lives right now. That can be a really powerful force for adolescents. Emotional health. So a person who has a lot of perfectionism or impulsive behavior, or maybe somebody who has difficult relationships, that can contribute to lowering their self-esteem and make them more vulnerable to a eating disorder. And then changes in a person's life, like going to college, starting a new job, those can be a stressor towards developing an eating disorder as well.
So non-suicidal self-injury is also another common mental illness. And so oftentimes non-suicidal self-injury is often simply called self-injury, but it's the act of deliberately harming your own body, such as cutting, burning yourself. Typically, it's not meant as a suicide attempt. Rather, this type of self-injury is a harmful way to cope with emotional pain, intense anger, or frustration. And so we know that 5 to 19% of youth in middle school and high school use non-suicidal self-injury as a way to cope. Those who use this coping method often need professional help. And so some signs or symptoms to look for for someone who may be doing non-suicidal self-injury or self-injury is scars. And often those scars are in patterns: fresh cuts, scratches, bruises, bite marks, or other wounds, excessive rubbing of an area to create a burn. Or they often have sharp objects on hand. A lot of times, though, they tend to wear long sleeves or long pants, even in hot weather, to hide their scars or their wounds. And so while we know that this is not a suicide attempt or an attempt to die by suicide, we know that somebody who uses self-injury or engages in self-injury, I should say, is often crying out for help. And so if you know somebody, we're going to talk about some tips and how to help somebody here in a little bit.
So now that we've discussed some of the more prevalent mental health challenges that youth face, I've got a document from Stetson University called 101 Wellness Tips for College. And really what we're using this as is some strategies for self-help. So if you think back to that continuum, kind of the first two squares on the left were healthy or coping. This is where you can really use some of these self-help strategies to either help yourself or your friends when you're in those two kind of boxes of that continuum. So basically, this is just a comprehensive list of some self-help strategies for college students, but a lot of them were good for mental health as well. And even though this document is specific to Stetson University, it's really good for any college student and really any person, adult or youth. They're really beneficial strategies for everybody to use, even though it is based on college students. But we'll go through some strategies here.
So one of the first strategies we want to talk about is sleep. So answer in the text chat for me, but do you do your schoolwork, read or watch TV, or use your phone in bed while you're laying in bed? I think we all do. I'm guilty of it just myself, right? One of my favorite places to watch TV is just laying in bed. And I think that we all do that, and there's nothing wrong with that, but we've got to really distinguish between a place to sleep and a place where you find entertainment. And so one of the first things we want to do is take a nap. If you have time during the day, a short nap can do wonders for your energy levels. We want to make sure that we don't nap too close to bedtime or for too long, but a nap will do your body good. We often call those power naps, right? So who would have thought when we were 4 and 5 years old that I would do anything for a nap during the day sometimes? I don't know about y'all, but that would be ideal for me, right? And so I just wish I would have kept that habit up from kindergarten, right? So the next tip is don't do your schoolwork or homework or work in bed. Working in bed can make getting to sleep harder. And so you want to keep your workspace separate from your sleep space to make sure you keep that insomnia at bay. The third thing we want to do is stick to a schedule. With different classes and work hours every day, it can be hard to stick to a schedule, but keeping a same sleep pattern or a sleep schedule from day to day can greatly improve your chances for getting a good night's sleep. So I like to get up at 7 a.m., right? We try to keep that as close to possible as we can. And then I like to really wind down by 9 o'clock at night. I'm normally in bed, relaxing, doing, just kind of chilling out at about 9 o'clock at night. And that normally means I can go to sleep by 10 or 10:30. And so I really try to stick to that positive, to that schedule, because I know if I don't, the next day is really tough, right? And so a lot of times you're going to have roommates, right? Some of you are going off to college and you're going to have roommates for the first time. So when you're sharing a room with somebody, it can be hard to go to bed when you need to not get woken up when you don't need to. And so try to make sure that you communicate with your roommates to make sure that each of you get the sleep that you need. Of course, once we have to avoid all-nighters. I know we've all been guilty of it at some point before, but you may feel like you need to study all night to do well on an exam or a project, but you're actually doing quite the opposite, because not getting enough sleep the night before can impair your ability to do well. It can impair your memory, all kinds of things. And so we need to make sure that we don't pull all-nighters. And then of course we want to make sure that we avoid caffeine, eating, or drinking right before bed. All of these things can throw off your body's internal clock. So we want to make sure that we limit all of that to a few hours before bed.
So some strategies to combat stress. Meredith talked about sticking to a schedule, the importance of that, and creating a routine. Make sure that you're giving yourself a break. If you've been working steadily for hours, make sure that you give your eyes and your mind a chance to rest by taking a break and stepping away so that you can come back feeling more refreshed. Make sure that you're realistic and understand that you can't do everything. Sometimes there's just no way that you're going to get everything done in one day or everything that you'd like to do. So be realistic about your goals and understand that you can only do so much. Make sure that you're taking advantage of campus resources. Most campuses have an academic center or coaching that can help you with time management and studying. Also, the counseling centers can offer free and unlimited confidential counseling to help you deal with your stress and anxiety and maybe any other issues that you're experiencing as a college student. If you've got hobbies, make sure that you're making time for those or trying to learn some new hobbies, because making time for the things that you enjoy and love is a really important part of keeping yourself from getting too stressed out. Make sure that you're making time for friends. There's really few things that can cheer us up like being around the people that we like the most, right? So make sure that we're making time to spend time with those friends. And then learn time management skills. Like I talked about, the campus resources can help with things like time management and studying to make sure that you're getting your assignments done and managing your load a little bit easier.
Okay, so the next thing we have to do is take care of our physical health, right? And so that means making sure that we get enough exercise, that we're eating the right foods, How many of us love junk food? I love junk food, right? But junk food actually does very little for us nutritionally, so physically, and it does very little for us mentally also. And so keep healthy snacks around. We want to avoid stress eating, avoid sugary and caffeinated beverages, and we definitely don't want to skip meals. And so the third thing we want to do is to avoid illness, right? And so we want to make sure, especially right now more than ever, wash your hands. Wash your hands so very much, right? Get with your doctor. Make sure that if you have any signs of illness that aren't going away within a few days, that you take care of that and take care of it quickly. And then, of course, keep up or be aware of any medication, and understand that avoid sharing. Sharing right now is not caring, especially after what we've experienced in COVID-19. So avoid sharing things like beverages, makeup, earbuds. Germs are so easily spread. And so make sure you avoid sharing those kinds of things with your friends.
And of course, what you're all here for today, some mental health strategies. Don't be afraid to ask for help. If you're experiencing something that scares you or that you're not familiar with, don't be embarrassed to ask for help. Many of these experiences, like we talked about, are really normal and treatable. And so the earlier you get help, the better. Make sure that you're keeping in touch with your family member and friends. Like we said, that can help with the homesickness and loneliness. Try to make new friendships when you're at school. That's part of the experience, and forming those new friendships can really help. Understand that it might take time to fit in and to adjust. It can take time to build those friendships, so don't get discouraged if it's taking some time. And then get involved either in on-campus clubs or in volunteer work. That can really help you from feeling lonely or isolated, and can really give you a sense of satisfaction that maybe classwork doesn't give you, so you can get out and help others in your community. And then set goals. If you've got goals, you'll be more motivated and positive that you have something that you're working towards, and achieving goals can really make us feel more confident.
All right, so we want to also encourage you to practice mindfulness. Some people use mindfulness to reset their perspective each day. So activities are used to guide the mind and be present in the moment, non-judgmental about how we think, feel, and behave. And so you may have heard this term before, right? But these activities include things like deep breathing or yoga, journaling, listening to music, whatever it is that you need to kind of recenter yourself and bring yourself back to being in the moment. That is the best way for us to really take care of yourself.
And I don't know if we have any parents or caregivers on today, but these can be useful for young people with their friends as well. But for our caregivers, understand that teenagers, when they experience things, they experience them bigger than we might expect them to. So we can feel frustrated by what a young person is doing or feeling, but make sure that we're not alienating our relationship with them. We need to continue to be supportive and encouraging. Caregivers should watch out for those warning signs like we discussed: withdrawal, changes in behavior or personality, harm to self or others, and then severe mood swings. And then we also need to be especially aware during traumatic experiences or big changes in a young person's life. So this would be loss of a loved one or a friend, maybe a parent's divorce, major transitions like from high school to college, things like that. We need to be really paying attention when a young person is experiencing that. Ask what you can do. It can be really tempting to assume that we know what a person would want. I saw in the comments earlier, y'all were discussing about, I like hugs, but my friend doesn't. So don't just assume that you know what a person needs or wants when they're experiencing a mental health issue. Make sure that you ask them what they need from you, and that can be really helpful. If you get a response like nothing, I'm fine, you can offer up some suggestions of what you would be willing to do, and maybe that would be helpful for them. Encourage those self-help strategies like we just talked about. And then youth mental health first aid, that is the training that Meredith talked about earlier. That is a training designed for you, for adults who regularly interact with young people. And it talks about all those warning signs, adolescent development, and has an action plan for helping young people in both crisis and non-crisis situations. And then they are coming out with, I don't know that it's been released publicly yet, but a teen mental health first aid, which is that same course for teenagers to take to help their peers with mental health issues.
Okay, so just to tag on to what Kaylee was saying, Teen Mental Health First Aid is actually going to be launched this fall, but it's a little different, and it's being launched in very specific school districts. And so if you get that opportunity to participate in your school, take every chance you can. It's really a great program. But there's also a lot of different resources out there. And so we want to encourage you to have that conversation, right? How confident, on a scale of 1 to 10, how confident do you feel about having conversations with your friends or your family about mental health? Awesome. So what we know is that talking about mental health is not easy. Oftentimes it's difficult and it's awkward. Oftentimes it's because you feel vulnerable, right? Or maybe that you're not the expert, so you don't feel like you can help somebody. But you don't have to be an expert to engage in conversations about mental health. We don't want you to avoid talking to a person because you think it'll anger and upset them. Oftentimes it gives them a relief that somebody is acknowledging something that they're experiencing. So just a few small words like, hey, how are you doing? How are you feeling? Can make a huge difference. And so whether somebody is ready to have that conversation with you or not, most people just appreciate the fact that you care and that you're trying to start that conversation. If you're not sure where to begin, sorry, my mouse went crazy for a little bit. If you're not sure where to begin, start with things with these openers. Hey, I've noticed that you've been showing up for work late a lot lately. Is everything okay? Can I help with something? Do you want to take a walk? Oftentimes engaging a friend or family member that you're concerned with in a healthy activity can be a great way to start those conversations. So we have to ask the question. And so if you've gone through a mental health first aid course as an adult, some of you may not have had that opportunity, then we have to ask that question, especially if we think that somebody is having thoughts of suicide. And this is different than, when we ask this question, this is different than, are you hurting yourself? Are you thinking about hurting yourself? This is asking the question of, are you thinking about killing yourself? We have to ask these questions because oftentimes this is a last resort, and people really just want us to ask, right? If they're challenging that, or if they're experiencing challenges that much, then they really just need us to ask. So if the answer is no, people will likely be grateful enough that you cared enough to reach out. If the answer is unclear, it's probably a yes. And I can appreciate that you might be hesitant to discuss this, but you want to use words like, I'm hoping we can be open as soon as possible so that way I can help you. But of course, if the answer is yes, we want to express gratitude that they have their trust in you. So we want to say, thanks for trusting me with that information. We want to offer hope and a choice to give them a sense of control. So thanks for trusting me with that information. Do you want to call the suicide helpline or the counseling center? Or I can do it with you. Never make empty promises or false promises. So don't ever agree that you're going to keep something like this a secret. We have to tell somebody, right? And so acknowledge that this is too big of an issue for you to handle alone, and you really need to get some professional help. Oftentimes these conversations you need to only have these conversations if you're willing to listen actively. No phones, no distractions, and whatever you do, you need to have some follow through.
Like Meredith said, if they are in a life-threatening situation, we cannot keep that secret, and we need to get them immediate help. But if it's a non-crisis situation, and the young person does not want to seek professional help, try to find the specific reason why they don't want help. Because they might be hesitant to look for help because they think that their parents can't afford it, or they're worried about being judged. And these are things that they really shouldn't be worried about, because there are a lot of different programs where they can get free counseling. And of course, counseling and therapy is a non-judgmental space for people. That's the entire purpose of it. So if we can find out why they don't want help, maybe we can help alleviate some of those concerns. If after exploring those options, they still don't want to seek help, make sure that you let them know that in the future, if they do want help, that they can come to you and that you will be there to help them out.
So there's lots of resources to help somebody who may be experiencing a mental health challenge or experiencing some sort of mental illness. And so in an emergency, you call 911. No ifs, ands, or buts, right? There are tons of resources, though, available. So there's the National Suicide Prevention Lifeline. So do me a favor. Everybody has a cell phone, right? I want you to put this number in your cell phone. I did it when I became a certified mental health first aid instructor. And I can tell you that I never thought I'd have to use it, and I've used it. Not for me personally, but to help a friend, right? And so this National Suicide Prevention Lifeline is a great resource, not only for somebody who is struggling or maybe considering suicide, but also for those who support somebody who may be considering suicide. And so the number is 1-800-273-TALK. 8255 for those last two numbers, or those last four numbers. You can text 741-741 and you just type the word hello, and a crisis counselor will meet with you immediately. The cool thing about the National Suicide Prevention Lifeline and the texting, the crisis line, is that they connect you to somebody, to your local mental health authority. There's lots of resources out there. There's lots of apps out there if you want to speak with somebody. There's professionals. Please understand that there are psychologists, there's licensed mental health professionals, there's therapists, there's psychiatrists, there's lots of mental health professionals, that can help you. And so I really encourage you, though, to put that number in your phone. Know that there are tons of resources out there. Oftentimes, as you go to college, there is a ton of university resources there. There's counseling services, wellness centers, there's a clinic, a lot of times they have their own dedicated crisis line or phone line. There's lots of therapy apps for meditation, for goals, sleep, tracking feelings, therapy, all kinds of those kinds of things. And then there's some what we call like mindfulness apps that have breathing techniques and those kinds of things. And then there's mental health first aid, right? And if you get an opportunity to go through that course, I highly suggest that you do. There's always professional organizations out there, like the National Institute of Mental Health and the National Alliance on Mental Illness, Mental Health America. There's specific organizations for disorders. There's lots of information out there. So just don't be afraid to reach out. So
So just remember that we are all on this continuum and that we all experience mental health challenges, and that it is okay to not be okay. Really, I want to thank you all for sharing your stories in the comments. That really helps it to make it more acceptable to talk about mental health and encouraging our friends and loved ones to seek help if it's needed. We really cannot improve the mental health of young people if we don't improve how people view mental health and mental illness. So by sharing your stories, it really destigmatizes it and makes it a safer space for everybody. So I really want to thank you all for sharing your stories. And I wanted to leave you with this quote from Lisa Oliveira that says, "Just because no one else can heal or do your inner work for you doesn't mean you can, should, or need to do it alone." Meredith listed a lot of resources. I encourage you to find friends and adults that you can trust and talk to them about your mental challenges, and just make this a better, safer space for everybody.
So we're running short on time. So what's going to happen now is we're going to move people over to a question and answer room. Kaylee and I will stay on for a few minutes and answer any questions that you have. But we want to thank you again for joining us and sharing your experiences. Certainly, it does help know that we are not alone in this. And so Jana's going to move us over, and then we will take questions over in that